Dr. Douglas Robinson, Campbell Podiatry. I'm going to talk to you about a very common condition that can occur with any sport activities, but it's really prevalent with dancers. This is a 12-year-old who started having pain a couple weeks ago, somewhere around the big toe, and we've isolated where she's actually hurting is right underneath the ball of the big toe joint, and there's two little bones here. They're called sesamoid bones, which are these little ball bearings that are actually underneath the big toe joint, called the first metatarsal phalangeal joint. And it's common for those to get damaged or just painful because when you're dancing, especially if you go on point or you're doing any type of dance, hip hop, any type of dance, you put excess pressure on the ball of the foot. So those bones can become inflamed. So that's actually where she's having pain. And you'll see on the x-rays, it looks like she has a fracture, but because she had another injury 3 years ago, I see on those x-rays that little split in that bone is something she's had since she was itsy bitsy, not from damage. She was born that way. When there's the split, we call it bipartite, meaning that bone has a little split in it. She was born with it and usually doesn't hurt at all, but the little bone has a little tiny split right in the center. So this bone here actually looks like two little ball bearings, where the one on this side looks like one ball bearing. And that's called bipartite, meaning two parts to one bone. Hers isn't broken, but she has inflammation of that. So when a bone like this is inflamed, we call it itis, means inflammation of the bone. And because it's a sesamoid bone, we call that sesamoiditis. So I see this with all kinds of sport activities, including dancing. She danced 4 days a week. And the way that I treat this, especially because she's a dancer, is we're going to use something called Jill's Dancer's Pads. So the purpose of the pad, which is an 1/8 inch made of silicone, is to offload this joint so that when she stands, when she goes on the balls of her feet, the pressure will go onto the pad and not directly on the area of sensitivity. So this is how we're going to take care of this. So the way that these are used, you peel off the sticky, the plastic here, and now if you'll zoom in on the foot here, you come right around here and you'll see the little ball bearings are located underneath the big toe joint. This is the one that she has that's split into two, but it's natural. 20% of the population naturally has that split, so it doesn't actually mean that that's pathologic. This is going to go around the big toe joint, so when she steps down, the pressure will be reduced to this area and this area, so ground reactive force won't be pressing on this area. And to make sure that she knows right where to put this, I mark this with a Sharpie. The pad is worn during the day when it's bedtime or bathing time. You basically take off the pad and then you wash it with soap and water for just 5 seconds. By washing this pad, it will re-stick day in and day out. If you mark it, then you'll always know where it needs to go so you're not guessing. Because if you happen to put this in the wrong place, if you put this like right underneath the sensitive area, you can go, wow, this is just making it worse. And typically I'll put this on both feet so she doesn't just feel that pad, that she's getting equal weight distribution and won't be favoring like, oh, I always feel that pad. So we put this on both. She's going to wear this every single day. I'll check her back in about 2 weeks to make sure that she's comfortable. And we'll use it we'll use this level of protection until she's completely pain-free. So when you have this sesamoid issue, you wear these during the day. When you're home, when normally you're unshod, like barefoot, you want to not be barefoot. Either wear your shoes in the house, or you can, come on over here, or you can use recovery footwear called UFOs. So this is how we offload these pads with the reusable dancer's pad. This is from Dr. Jill's, and it's called the dancer's pad. I also use this commonly for people that have an arthritic great toe joint to offload this area here. So we do this as a treatment-directed test. Can I just offload this, allow her to keep doing everything that she does, and this helps her to feel better. So that's how we take care of sesamoiditis. I'm Dr. Douglas Robinson. Please take care of yourself and each other.